Good morning, everyone. Today I'm going to discuss one of the most neglected care that should be given for mothers in the postpartum care period. As you know, postpartum period is a period after the birth of a baby that extends to up to 42 days. During this time is the most critical time where different complications can happen, which can threaten the life of the mother. And so this is a critical time when the woman, the newborn, the partner, the family as general should give a care for the mother who gave birth. And so postpartum care starts from the time the mother gave birth. And this is the most critical time, especially the first 24 hours. Out of 24, the first 6 hours is the most critical time. As you know, the most common cause of maternal death worldwide is postpartum hemorrhage, and this is the time after delivery, especially the first 6 hours is the most common time for postpartum hemorrhage to occur. And the postpartum hemorrhage can happen due to uterine atrophy, or when the uterus fails to contract well. This excessive bleeding can happen, which can endanger the life of the mother. The second time when bleeding occurs if there is episiotomy, or if there is tear on around genital area on the vagina or cervix, and if it is not detected and repaired, bleeding can happen. And the other things, after delivery of the baby, the placenta, the membrane should completely be removed. And so if this parts of conceptus are remained in the uterus, and excessive bleeding can happen and cause bleeding, anemia, shock, then even to the level of maternal loss can happen. And so after delivery, first thing we should check that the uterus is well contracted, and we can check that uterus is well contracted by massaging, especially the first 2 hours. The uterus should be massaged every 15 minutes and check if there is well contracted or not. And the other thing, check if there is excessive bleeding through vagina or not. And the episiotomy, the tear should be grossly well checked and repaired, and when you remove placenta, the placenta should be removed completely. In this way we can prevent complications that can happen due to excessive bleeding during this period. So this is one of the things that we should strictly follow in the check for postpartum hemorrhage, and we should prevent it. The other common complaint that can happen in the postpartum period is postpartum pain. Postpartum pain can happen when if they have gone through vaginal delivery. If episiotomy is given, the pain can happen, can occur from the episiotomy site, or during delivery if there is spontaneous tear in perineal area. This can cause pain. And if they have undergone cesarean section, incision site pain can happen, and this can cause the pain affect their quality of life. And so we should give them adequate pain management. And if it is episiotomy episiotomy site pain, or perineal tear occur, one thing, in the first 24 hours, especially cold ice pack is the most important. They can apply cold ice pack to the perineal area, so that it can help them decrease swelling around genitalia, desensitize the nerve fibers, and decrease pain that can happen due to episiotomy site. And the other thing, after 24 hours, if they have episiotomy or perineal tear that have been repaired, we advise them to have seat baths, and to prepare seat baths. They can warm the water, and in the water need to add adequate amount of salt, and in a large container we advise them to sit and clean their genitalia with this salty warm water at least 1 to 3 times a day. In one period they should stay for 15 to 20 minutes. And this salty water is important one, because this hypertonic solution, it will decrease swelling around genitalia, and because the salt has some habit of desensitizing nerve, so it will decrease the pain. If there is swelling decreased, then blood flow to the episiotomy site will increase, and enhance the healing of the wound at the episiotomy site. The other salt has a sort of antiseptic effect, and so it will decrease episiotomy site infection. So this is the most advised thing that mothers after delivery, especially after 24 hours, we should advise them on seat baths. And the other cause of pain in the postpartum period is what is we call after pain. After pain can happen, especially after 2 to 3 days, especially with when the baby suck the breast, they will have cramping abdominal pain that occur due to uterine contraction. As the uterine contract to involute, this will cause pain, and the mothers can suffer from this pain. And so what we should do for this is giving antipains of different forms, like ibuprofen can be given, diclofenac, tramadol can be given. So we should manage the postpartum pain according to the cause. The other thing that should be done in the postpartum period is, as we know, especially during vaginal birth delivery, as the fetus comes through the birth canal, it damage pelvic floor structure, especially muscles that are important to keep pelvic organ in their position, that are important to maintain urinary continency, fecal continency, flatus continency. This muscle can be damaged when the fetus comes through the birth canal, because this the fetal presenting part can stretch this muscle, can tear these muscles, can weaken this muscle by disruption of blood supply to these nerves, by disruption of nerve supply to this muscle. This muscle might be weak, and so after delivery their urinary or fecal continency might be decreased, and so might have a complaint of fecal or urinary incontinency. And on the top of this, if they have episiotomy, this pain episiotomy, if they extend this, they might damage these muscles, and so might weaken these muscles and predispose them to have urinary or fecal incontinency. So after delivery, what is advised is mothers should do Kegel exercise. Kegel exercise is one of the most important things that should be done to have to strengthen these muscles. How we do it like if you are in some place where you feel sensation of urination or sensation of defecation, but you are not able to reach to the toilet. What you should do, you try to hold anal or urinary sphincters to control. So doing that thing, doing activity, trying to control urine, trying to control the passage of flatus will strengthen the muscles and so prevent urinary or fecal incontinency and long-term pelvic organ problem. So we should advise mothers to do pelvic exercise after delivery. The other problems that can happen in the postpartum is breast engorgement. This breast engorgement can happen when if the mother is not adequately feeding the baby breast milk, so the breast will be filled with milk, and so it might cause pain. The other cause of breast engorgement, especially in the premise, if the nipple is not well everted, if the nipple is well everted, and it is difficult for the baby to suck, so the baby will not suck adequately, and so the breast will be engorged with milk, and this can cause pain. And so to prevent this one, what you should do is, as much as possible, if the nipple is inverted or it is not everted, we should try to invert it by pulling, by using fingers or by using breast sucker. And during breastfeeding, the mother should follow adequate proper breastfeeding position, should be conducted to decrease breast engorgement. And the other thing is, if this is not relieved with breastfeeding, we can use non-medical, non-pharmacologic management using ice pack or warm water applying to the breast, so that can help decrease the pain. And if the pain is not relieved by this one, we can use medical like ibuprofen, tramadol, or diclofenac as treatment. And if it is not relieved with this one and have sign of infection, the patient should be evaluated by professionals and treated accordingly. The other complication or problems that can happen in the postpartum period is constipation. Is common in the postpartum period. One because of the hormonal effect, delay gastric emptying, decrease peristalsis, so the stool stay in the intestine for long and will be constipated. The other thing is after delivery they may have pain from episiotomy site or surgical cesarean incision site, so they will fear to go to the toilet to defecate, and so the stool will stay in the intestine and cause predispose them to constipation. The other after delivery, because of fear to go to toilet, they may not adequately take fluid. This will also lead to constipation. So if there is constipation and whenever they try to go to toilet and defecate, they may be at risk to develop hemorrhoid, and this hemorrhoid might be inflamed, and this inflammation or superimposed infection might cause severe pain. So as much as possible we should avoid or prevent this complication. So to prevent this complication, one, the mother should drink adequate liquid diets. The mother should take adequate liquid diets, and we should advise them to take high fiber diets that are made of fruit and the vegetables like cabbage, carrot, and different vegetables that can bulky their stools and decrease the risk of constipation. And the other, if they develop the postpartum hemorrhoids that is inflamed or infected, we advise them to have seat baths. To do seat baths, as I have already said, in a warm water, making an adequate amount of salt in a warm water, and then advise them to sit for 5 to 15 minutes 3 times a day. Can help them, this salt, because hypertonic, one, it will disinfect, the other, it will decrease the pain, the other, it will enhance healing, and so we advise them to have seat baths. And if it is not controlled by this non-pharmacologic management, they may go to health institution and might get like anti-hemorrhoidal treatments, which are ointments that can apply to the hemorrhoid, inflamed hemorrhoid. If they are not resolved by this, so definitive management by surgeons might be needed after postpartum period. The other issue that most of the time neglected is postpartum psychological problems. Mothers after delivery might be at risk of developing postpartum blues, postpartum depression, postpartum psychosis, and this can happen especially if they are have psychiatric problems before pregnancy, or that happen during pregnancy. If there is conflict between the mother and the husband, if they don't have adequate care during pregnancy in the postpartum period, if they develop complication during pregnancy or intrapartum or after delivery, if they give birth to a baby with abnormality, or the baby develops illnesses, or if the baby is lost, the mothers might develop psychiatric problems of different sorts, and so they might manifest with like lack of sleep, agitation, hallucination, delusion, crying. This can happen, and so as much as possible, if this blues sort of the time to resolve by themselves, what we should do is care for the mothers. Is very important. Family support, psychological support for the mother is important, and if it does not resolve by this, they should be taken to the health institution, be evaluated and managed accordingly. The other thing is mothers as general, females as a general, are at risk of developing anemia, especially in during pregnancy because of increased demand, and during labor and delivery because of bleeding, they might develop anemia. And so to prevent anemia and restore their iron status, we should supplement them after delivery. If they have anemia, they should be treated with treatment dose or therapeutic dose. If there are no anemia, they should be supplemented after delivery at least for 6 to 12 weeks. And also we should advise mothers to take adequate diets that have high iron content, like injera made of teff, especially the red one, red meat, liver, beans, and should be taken. These are foods which are rich in iron, and we should also advise them to take diets that increase iron absorption. Fruits like orange, apple, mango, these are citrus fruit, which will increase iron absorption, should be advised. And also we should supplement them with iron tablets. The other thing that's mostly neglected is after delivery. In our culture, most after delivery mothers are not allowed to ambulate, but this is not good. They should ambulate. One, because if they are not ambulating, and big also in the postpartum period, they are at risk of developing postpartum venous thrombosis, which can threaten their life. And the other thing is they will not feel a sense of well-being if they are not ambulating. The other is at risk of gaining unnecessary weight. So to prevent this, mothers after delivery are encouraged to ambulate. That can be simple ambulation in their house, in their compound, or walking around is very important. One, it will sense them to have a state of well-being. It will decrease the risk of complication of venous thrombosis. It will decrease the risk of unnecessary weight gain. So we should advise them on this. The other issue that mothers after delivery should be counseled is on contraceptive issue. After delivery, mothers, especially if they are not exclusive breastfeeding, they are at risk of developing, having unwanted, unplanned pregnancies. So, especially if they are not adherent to exclusive breastfeeding for the first 6 months, we should counsel and provide them with option of contraceptives. And as the options of contraception in the postpartum period, they can use mini pill or progesterone only pill, Depo-Provera, Planon, ICD can be used in the postpartum period. So by doing this, mothers in the postpartum period need to have a strict follow-up support, and if there is complication, early intervention to prevent maternal morbidity and mortality. And thank you.